Welcome to the office. How are you guys?
Very good. Thank you.
Welcome.
Thank you.
Hi.
Hi.
Welcome to the office. Hi.
Hello.
Who's the patient?
Aliyah.
Hi, Aliyah.
Hi.
What's going on?
My feet turning.
Hold on. Where are you guys coming from?
Florida.
What part of Florida?
St. Petersburg.
St. Petersburg? Is that? I don't know St. Petersburg.
Tampa Bay.
West of
Tampa Bay. Okay. Tampa Bay area. Right on. Okay. Why are you guys here? Why are you here? You're here because there's some issue going on with your feet?
Yes.
You want to tell me about it?
Yeah, my feet turning, and when I walk, sometimes I trip over one foot.
Do you trip over one foot more than the other?
Yeah.
The right or the left? Can you put your
The
feet
right.
down, please? Put both legs down. So you can see Aliyah just sitting there. She has bilateral toe in. And if you guys have heard me talk a lot, was there any trauma, slips, falls?
No.
She was born like this?
Yep.
Yeah.
Okay, so we need to get into the why.
Mm-hmm.
But historically, when I've seen bilateral toe in, it's usually been from a sacral misalignment, usually S1, S2. The sacrum pops back, right? Follow the process, sacrum pops back. The pelvis flares out, causing bilateral toe in. So that's when toe in. Now, conversely, I've talked about cases, and we've had cases where there's bilateral toe out, where they kind of walk like a, duck walking, yeah. And the duck walking is usually an upper cervical issue because the body is innately trying to balance itself. Make sense? So it'll be interesting to see. We did take some x-rays, but I'm waiting on that to share with you because I didn't share with you guys yet what it is. Okay, so you're how old?
9.
9 years old.
Yes.
And you've noticed this since?
So we started noticing it when she was crawling.
Okay.
So our first step was really we went to the pediatrician, but because
Can I rewind for a second?
Sure.
When you say crawling, like the first week of crawling?
Yeah. Oh yeah. Daniel noticed it, and he was like, "Do you feel like her feet turn in?" But she's crawling. She's a baby.
Right.
But I did mention it to the pediatrician, and she says it's too early. Just give it some time. I went to the specialist at 2, at 3. I mean, just consistently over the years.
Okay.
She was just there last year when she was 8. Pediatrician, orthopedic surgeon, orthopedic podiatrist, even a foot and ankle.
Specialist.
I've been to several.
It progressed. So it
Yeah.
progressed from just her pediatrician
Yes.
to we wanted more special care. So we went to orthopedist. And then the last was, we even went to a chiropractor.
You're going to hold it for
thank
that.
you.
Yeah.
You get to hold it for that.
We even went to a chiropractor who treated the whole family and maybe did some minor adjustments, but only minimally mentioned anything about seeing anything wrong with her.
Did
alignment.
anyone take x-rays?
Never.
Hold on.
Never.
The spine, the foot, the knee, anything?
They would check at first when she was younger, they would always check the knees and the shin and
Okay.
make sure that aligned. And if you pull her leg out, it looks pretty straight, except the feet always would turn in. The only quote unquote diagnosis I recently got, which was a year ago, consistently, it was twice I heard it, and it was, "Mom, the hips turn inward."
Correct.
So,
but why do they turn
right,
inward?
and it was just, that's how she was positioned in the womb, and there wasn't really anything she's going to grow out of it.
Did she go to term?
Oh yeah, and she was natural.
Natural birth?
yeah.
How long was the labor?
Oh gosh,
Ah.
I can't remember.
Short, long,
Yeah,
do you
it was
remember?
not long. It was short.
Not long?
Yeah.
Well, she's
Yeah.
number what?
3.
Okay.
Yeah.
And are you getting pain when you walk, when you sit now?
It's like when I walk, my heel starts hurting.
Both
or my
heels?
knee. No, it's only this one.
The right side? Okay. And how about when you're sitting at school? What grade are you in?
4th.
Cool. 9-year-old in 4th grade. All right, you're pretty smart.
She's going to.
Nice. Pretty smart, huh? That's cool.
But when she runs, so
Well, I'm not even at the running right now. I'm at the sitting.
yeah.
So this is her normal posture? Yeah? So if you sit up straight like this, is it uncomfortable?
Yeah,
It is,
a
right?
little.
It doesn't feel good.
Yeah.
So hopefully after today, you're going to be able to sit straighter without pain. And if I do my job correctly, it's going to hurt to slouch.
Oh.
That's my job. I don't like slouchers. I'm slouching now too.
Slouching.
I miss my stool. I miss my stool. Okay. All right. So jokes aside. Okay. I know I joke a little bit too much sometimes. So when you're sitting at school, do you find yourself, your tailbone hurts when you sit?
No.
Doesn't hurt.
It doesn't hurt.
How are your seats at school? Are they wooden or plastic?
The plastic.
Okay, that's better. I used to remember having wooden ones. Okay. And PE. What do you guys do for PE?
We run around the track like one lap, and we had to do a mile.
Okay.
So then that's when like my knee was hurting, my right one,
Okay.
and we run a lot, but
Okay. Any sports? You guys do any sport?
we play like kickball and stuff.
Handball,
stuff like that.
kickball,
Yeah.
soccer.
Yeah.
But all that requires running, right?
Yeah.
And all that hurts or it feels uncomfortable.
Well, sometimes it hurts, but like sometimes it doesn't. It just
Okay.
feels fine.
Okay. And so we saw her feet. We will watch her gait. She has functional flat foot. She pronates at the same time, but that's a compensation. I'm going to show you something really cool, Dad. Remember crossing your leg? Can you cross this leg over that? Actually, for Shasha first. Cross it the other way. Yeah. And go back. So this is non-weight bearing. Let this hang. There you go. She has an arch.
Yeah. Wait.
Other side, let Dad see now. Okay, she has an arch.
Right.
That's a functional issue. That's not a structural issue, meaning what? This is compensating for something else. Okay? The other thing we look at, and we'll evaluate the feet. I didn't take foot x-rays, and if I have to, we can do it later. That's not the focus. Does it hurt when I push here? Probably. Yeah. How about the other one? Let me see this one.
A little less.
Yeah, so she sprained that ankle also. So she sprained that right ankle at some point. Along the way, probably tripped or something along the way. We'll fix all that, don't worry about it. The thing I'm gonna ask is a little weird though.
Okay.
She didn't get dropped.
Nope.
She didn't fall out of a crib. She didn't fall. You
Nothing.
sure?
I promise.
I'm just saying because what I see, it was either there was a trauma in the tailbone. I'm gonna show you on the X-ray. Okay, something happened before. If you said you started to see this when she was crawling, then from the time she was born, I'm not saying in utero in the womb, but from the time she was born until she started crawling and you saw it, there was a tailbone injury, guaranteed. I will show you. Okay, guaranteed. So maybe, I don't know, you were with her the whole time, maybe she had I don't know.
Yeah.
But let me show you the x-rays. So we did do your full spine x-rays. This is you, Aliyah. This is a picture in time. Tells us how you've evolved from birth. This is your right side. I'm going to put it there, and I'm going to put it there. We have 24 bones in the spine that move, and in kids, they have 5 sacral segments that haven't fused yet. Okay, they're still individual segments. They haven't matured or ossified. We can see there is some curvature going on in her spine, and we got to figure out why that is. And why I said the things that I did say. So if we look at her x-ray here, we can see in order to have a stable building, we need a level base and foundation. Do we have a level base and foundation? We're a little bit off. And this is where we're going to get our answer now. Part 1. You see that, guys? So the foundation is a little bit off. I'm going to darken it up a little bit. Okay, so we have a tiny, I'm not worried about 1 millimeter of rotation of the tailbone. That's not what I'm worried about, concerned. There is a drop slightly on the left side of the, which side were you complaining about? The right, yeah. Now what's interesting is I'm finding the left as the issue. The right has probably been compensating for the left side. So let's talk about what we have here. We have a rotated pelvis slightly. Now, PIIN or ASEX means there probably was some fall or it's not posture. And the reason why is the mechanics of the SI joint, the way they work. When it goes PI, posterior, inferior, it naturally wants to go out. When it goes AS or anterior, superior, naturally wants to go in. So if I see, typically it would be a PIEX or an ASIN, with a trauma or posture. In this case, I don't see it as posture that started this thing. The other thing I see is because we have a slight drop of the tailbone here, or of the sacrum on the left side, right? If this was level, then I'm thinking, okay, it wasn't a trauma. Maybe it was in birth. Maybe it was something else. But there was definitely some trauma, and I'll show you on the other x-ray before we continue. Well, I'm going to show you. You can think about it. It's right there. There's your answer, S1. So I talk about this a lot. This is the tailbone. This is L5. This is S1, S2, S3, S4, S5, and then the coccyx is down here. But this is a classic S1 subluxation base posterior, okay? Sorry, yeah, L5, S1. So this is the S1 segment, this is S2. This is the issue, S1. There may be something at S2, maybe. That's your answer, okay? And that's what we're going to work on. That's your answer. That's your tailbone. Let me show you. Let me show you. This is your spine. I don't have a baby spine or a kid's spine. I have a big spine. So this is your tailbone right here, okay? And you have 5 segments. 1, 2, 3, 4, 5. But in a child, it's individual segments, which means they move, which means they swell just like discs herniate, and they cause nerve pressure. Look, those are nerves. Right? So we have nerves, S1, S2, S3, S4, S5 nerves. Now, her first sacral segment, which is that one right there, remember? I just touched a little bit and it hurts. That's what we have to fix. And it's not hard. Okay? Okay. But you have one job. You have to walk as much as you can while you're here.
We're going to Disneyland.
Deal? Perfect. Perfect. So that's what I see there, guys. Now, we have a couple of things else to talk about. So we have the S1. We know it's a tailbone drop on that side. Now, that tailbone drop was enough to cause the spine to deviate that way. Okay? So it starts to go to the left side. And you can see they look like different sizes. They're not. It's the twisting of the spine from the compensation of the tailbone. And then what is it doing? It's doing it again.
Yeah.
It's compensating.
And you're going to fix that.
I'm not working on this right now. You're only here for a layover. You're only here for a layover, okay? My job, look, this. I'm going to see her in the future, down the road, okay? And the reason why is as we fix this, we're going to need to see how she evolves. And even that may just mean you coming out in a year, okay, or 8 months. I don't know. We'll figure it out along the way, okay? So, but I'm just showing you your answer. It starts here. It curves, it curves, it curves. 1, 2, 3, 4, 5. You can see 5 is twisted more. You see these little circles? So the circles tell me how they've rotated. See? So it goes, see, small, big, really small, big, really small, big, small, big, small, big. They start to level off. Now, in the upper cervical, how's your breathing? Did she have any sinuses or breathing issues? You said respiratory, but not. That was just that one time. Cool. All right. So that's the answer there on that. The rotation of the pelvis will also affect, and here's what I want to talk about, growth plates. Because in a kid, they haven't fully developed. And I've had so many cases where we work on them during this growth phase. Look, these are different. These are different shape. You can see the shapes are different, right? Okay.
This is fuller?
This is, yeah, so you see this looks fuller, right? But it's not that it's fuller, it's the rotation of the pelvis making it, so look, this is the right side. EX means it's doing this, so it's making the femur look bigger. But I'm looking also at the growth plates here. They're not symmetrical. You see, this one is almost formed, this one is still developing. So they're asymmetrical due to the misalignment. So that's what, this is the blessing that we got it early, okay? We got it early. You're gonna be fine. I'm just pointing out stuff. I'm the doctor. I got to doctor this, you know? So, okay. Follow me, guys?
Yes.
Okay. So that's the more concern to me, look how this is whiter. We call that term is called enuberation. It's whitening of the bone because there's more weight put on that on the left side. She favors the left more than the right. And now that she says she has more pain on the right, she favors the left.
And the right she drags, I feel, sometimes.
Well, we'll take a look at it. Does that make sense, guys? Yes?
Yes.
Dad? Mom?
Yes. We got us thinking about the trauma now,
I
though,
know.
because we're reeling about it.
Well, you can figure that part out. I'm just saying she got the perfect Megan Blasey. You have the perfect gastric air bubble. That's a blessing. Don't mess it up. Everyone I see here has digestion stuff going on. And the only thing I would say is, I'm just looking at the shape of the bones, make sure they haven't changed shape. And I'll probably do a re-x-ray, just a spot shot of the pelvis before you guys leave. Because there may be something there that I can't show you because of the heart. It's right there, but it's not something we need to deal with anyway, okay? And we'll talk about that later. It's just a finding, that's all.
So my question, and I don't know if you can answer it, everything that you're seeing, however, is fixable.
The sacrum is fixable. The sacrum is fixable. If we can fix that, we can change the mechanics of the pelvis and the foundation.
Okay.
And I've seen cases like this. Look, my business is not trying to straighten out these curves in the spine. That's not my business.
Yes.
My business is level foundation. My business is where's the pressure causing the problem. She needs more curve in her body. Her spine is way too straight. Okay, we need the right curves in her body. She needs to have to develop her secondary. She's too straight. Her discs are good, but she's too straight. So we'll talk about that along the way. Okay, but this is the answer. That's,
I've never heard
That'll
that
fix the
before.
in-toeing and...
think about it, okay, mechanically. This is how it works. This is how we were taught.
Yeah.
At least this is how I was taught. No, a lot of the Gonstead guys, most biomechanists understand this concept. Look, you were told this turned in.
Yeah.
Okay? So the sacrum goes back posterior, causes a flaring of both PSISs to turn in, causing the toe in. But then there was some misalignment also of the pelvis.
Yeah.
Whether that was after or I don't have that answer. Regardless, we got to fix it.
Right.
Okay? So we'll see her while she's here. Probably 1, maybe 2 in a particular day. I don't know yet. But that's the answer. Okay? So what's your favorite subject you said?
Math.
Yeah. So you're going to learn about L'Hopital principle. It's how the calculator works, right? If I'm not mistaken. You like decimals, math,
Yeah.
addition,
Yes.
fractions,
Yes.
division.
Yes.
What's 572 divided by 12?
Uh-oh.
Here's what we're going to do, Aliyah. Turn this way. Okay, and what I'm going to have you do, very simple. You're just going to walk to the end of the room. Follow me, okay? Let me do it first. You're just going to walk normal, however you walk. If you're toeing in, toeing out, whatever, you're going to go to the end here, you're going to turn, and you're going to do this. And you're going to walk several times, okay? And I'm going to sit on the floor, and I'm going to watch you walk, and I have to see the back of your gown. No, I have to see the spine.
You're good.
That's good. So first thing is march in place. March in place. Knees up high. I just got to bring that down a little bit. So when she's doing that, there's not a lot of movement here. She's just kind of rigid when she walks. Walk to the end of the room and back several times, please. And take your time, okay? So yes, we have the bilateral toe in. We have the EX on the right, which makes the right go in even more, right? Because it's turning this way. So the sacrum was the first, and then the EX caused more on the right. You can see it swings out. You got the St. Petersburg?
Yes.
St. Petersburg wiggle. She got the St. P wiggle. You can handle me, right? No, I'm just, I just joke a lot, right? Keep going.
She's gonna believe.
You got all your baby teeth out now?
No.
How many cavities you got?
0.
2?
0.
0? Okay. Well, we call these subluxations in the spine, they're like spinal cavities. So you got a little spinal cavity in your tailbone we got to take care of, okay? Keep walking. We're just we have something to look at and compare for later. You guys all see what I'm saying, right? Yes. You see it's going like this, and she's turning out like that. Okay, in the barber chair, let's cut your hair. Face the window, please. There you go. Have a seat. Starting at the base of the neck, let's see what we got. And the first thing we're getting is up top in the upper cervical, 20 points, left side, C1. And as we go down, do. I need to bring these down, okay? Because we need sit up straight. It doesn't even look, I mean, you can't even see the spine here because it's curving out. Go back there, guys. Go right back there. Okay. So, right back there. So you can see it curves in, but look, this doesn't go in. And, correct. Remember I was telling you there's no curve in her spine. Are you ticklish?
Yeah.
Stop it. You're not, there it is. Didn't it? And booyah. S2. Come on. And let's tilt it the other way. People ask why we tilt. It still goes to the left. Mm-hmm. Tilting is just in case there's bilateral pressure coming out of both nerves. Mm-hmm. And so I tilt it left, it breaks left. I tilt it right, it still breaks left. That's the left nerve. And it's consistent with what we found there. So she got pressure in the basement and the penthouse. But we're going to start in the basement. Okay? This is actually a really serious case, and it's serious enough where it's affected the quality of life of not only her, but the whole family. And let's go ahead and feel what's going on here. This is L5. This is S1. Tender?
Yeah.
Yeah. How about that one?
Oh, ow.
Oh, ow. That's the one. Right there, S2, where we got it. That's that bump going back.
That one.
How about that one?
A little bit.
A little bit. Not as bad as that one.
Yeah.
Okay. Almost good. We got the answer. Ah. It's okay. Don't be helicopter, Mom.
I'm sorry.
Back it up. Back it up. People are either going to love this episode or they're going to be like, who is this guy? It's okay. It's all about making them comfortable. And I got, sit back there. I'm just checking now, okay?
Just checking.
You feel that left side?
Ow.
You feel that right side?
Not that much.
Let's turn a little bit this way. Here we go, loop-de-loo. Here we go, loop-de-lie. All right, let's go this way. Okay. Left side. How about the right?
Not that much.
Right there. Yes?
Yeah.
Left atlas, S2. Okay? So that's where we're going to start. Let's do both of those. Then we'll recheck her, see how it's feeling, and then we'll watch her walk and see if anything starts to shift. So the way we're going to do it, let's put up the x-ray. We're going to go right side down. So you're going to go over here, lay down on your right side. I'm going to take that out. I got you. You are all good, girl. Now I'm going to do a S2. Relax there, please. Now she's actually super flexible.
She is. Yeah.
Now, thanks. Let's make Dr. Rahim's job. Look, it already started to go. Nice and easy there. Just like that. That's the home run. That wasn't bad. You got giggles. Go on your back.
Good.
Go on your back. Yeah. All right. Does that hurt your back when I do that?
No.
Mom, can you move the pillow? Doesn't hurt your back, right, when I do that?
No.
I'm going to keep going. Can you turn them out? Turn them out. Yep, just like that. Turn your feet out like that. So just at your feet, I want you to go like this. Does that hurt your back?
No.
Turn your feet out. Good. Turn your feet out. Does it hurt here when I do that? A little bit. That one hurts more, or that one hurts more? The right side? Okay.
They both feel equal though. Kind of.
They both hurt?
Yeah.
Okay. Let's do some Hollywood magic. Talus.
I'm sorry.
It's the.
It doesn't
It's from the sound. It's from the prop room. Okay. Go ahead and stand up, and I'm going to have you walk again. Okay. And
Do you want this open?
yeah, as you're walking, you can tell me if anything is different so far. Not your feet right now. First, I just want you to see how does your back feel when you're walking. Does it feel any different when you're walking?
Yeah, a little looser.
Come back over here and have a seat, please, in the chair. All the way back.
Oh gosh.
I got you. Don't worry. Left ear. Do-do. Do-do. Left ear. Hands on your lap. Mom, you can actually come help. Stand over here. Put the phone down. Since I don't have a strap on this chair, you're going to stand over here. And you're going to place your hands like that.
Okay.
You're going to place a little more pressure. No, not so hard. Just like that. Just like that, okay?
Got it.
Just like that. You got her?
Mm-hmm.
There it is.
Oh.
Gotcha.
Ow. It didn't hit that.
Okay.
That was a lot.
That was a lot.
Come on up. That's all that self-cracking. And now let's walk.
That was a lot.
Mm-hmm. Come back over here and have a seat. Now put a little curve in your back. Scoot forward. Scoot forward. So here's the first test. Come. Sit up a little straighter. And the first test is how it feels. Come back slowly, back towards me in extension. Curve your back towards me. How does that feel? Does that hurt when I do that?
A little bit.
Is it different from before?
Yeah. Way different. It doesn't hurt that much.
I'm going to go a little more each time. Sit straighter. There, put a curve, 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 curve. There you go. We got to get that curve back. 2, 3, 4. No pain?
No, not that much. Just a little bit.
A little bit, right?
Yeah.
Okay. Now let's buff it out.
It feels weird.
So the goal here on this trip is to get this stabilized, get that pressure off the sacrum. She's got a lot of crackling as we're getting through it. A couple of adjustments, you'll hear them, they'll go deeper. There's a lot of scar tissue there too, okay, because of the compensation. Then when she goes back home and through your travels as well, it's just movement, okay, lots and lots of movement. And you're going to give it a few months for her body to kind of start to readjust herself. Okay? 5, 4, 3, 2, 1. Okay, go walk it off again. Check it out. Keep going. Can you walk on your toes? You know what? I want to do one more. Let's go back over here. One more. No, I'm gonna do it from the opposite side. Let's go on this side, please. Lay on your side.
This way.
Yep. That one was crunchy, yes, but I want to have a little deeper set. You okay there?
Yeah.
Okay.
Wait.
Yeah?
Yeah.
Okay. Clonk. That was it. Okay, come on up. Come on up. Walk it out. Little more better? Yeah. Okay. Go be a kid now, okay? Squeeze.
Oh gosh.
Squeeze.
I saw this. Oh gosh.
Squeeze. Ah! Slowly squeeze. Okay, a little bit on the elbow. And the wrist. There you go. Turn and face. Okay.
Ow.
Mom told me to do it. Have a seat now. Jokes aside, have a seat. Let's go back in position, Mom and Dad. And let's talk about what we did here.
Yes.
That's for you. So what I did, we found S2. We did the atlas. I did that last adjustment. The first one was crunchy. I watched her walk. It was a little better, but it felt like it needed a little bit more. That second one was a nice clunk. It went in there nicely. And let's see what happens, okay? Deal?
Yeah.
And then you guys go enjoy your trip. You come back. We'll do a follow-up, see kind of how she did. And we'll probably take a spot shot, like I said, of the pelvis and the side, just to see what changed in the sacrum, okay? And then we'll make some decisions on our last day.
Okay.
Fair enough?
Anything that she needs to not do? Or?
No, it's just ice. Be a kid.
Okay.
There's nothing. There's no restrictions.
She's good at that.
She did great.
Yeah, you did amazing.
Proud of you, baby.
Good job.
Yeah.
Welcome to the office.
Thank you so much.
Welcome to the
Thank
office,
you.
guys. Welcome.
Thank you so much.
You're welcome. God bless, okay?